Dedicated bad. He's been busy here. Dr. Mark. Hello. 0302216561 0302216562. Odo Alma Sunday, don't worry, and I do a bed there. Yet the Bema freestyle. Bema Kwa Badiba Odo Ahomaso.
I don't so.
Me da say. Wouldn't baby a free. Yo.
But you remember, I said 101 times. Yeah, and I knew him diabetes. It didn't move him. In the same in the course of it.
What was the question? Maybe I can't wait until ye to Bonacasa way.
You say, you mammy, a young not equal. You are Naba. You are Naba. I had diabetes 101 times. But you include you again. Then it is
and a chrono, the same place na a kwana banana.
Different place, but one leg.
One leg. Wow, what did you say? Maybe I shall say. Or Connie 70s. And if you say a chrono, a corner, banner, it's been there for how many years?
Oh, for about a year and a half now.
A year and a half. Okay, yo, yeah, that's it. You are no. Although I was so near me, my quabby about down so.
Oh, don't so.
Me that say, we didn't be free.
No, but your friend Isaac, me can just be Pugwases.
Yo, it's you.
I'm about your Macuna come very by me, and come and I'll pay Maco hospital, me blood stress and many 24 years. Me 171.
Over there.
But what is
171 over there.
Hello.
171 over there.
And but I said in there, oh my mind, I saw the independent on my way.
How many times now?
But my year 2 times, but first one no man can. And the second one I'm person can be the minya and second one no more the children my. That means I said the end so everything stop with the independent. The 171.
Okay, yo, Dr. Swate, that's say. Me ma kwa ba de border homa so. Me da say it you. Where do you fear him? Okay, yeah, wunya baby o ya na. Wouldn't so be brana. Okay, in a day, we fan say at one so to a say no my hand, says sachets and so on my hand in a day. In a day. Okay, yo, yeah, that's it. Me ma ko about that home so. Me that say, we didn't be afraid.
If I'm a chance, no, I've worked for you.
You open it you.
And in fact, if I am not thinking for the past 2 weeks, I've been thinking, yes, between that, I am thinking.
You, what if you are here?
This is the truth.
Osana Baku, Naya Nasa Mirina. Nifa de Netaye.
Yes, I didn't know, yes, and what be the name
Now I say Muki Kawana.
A monkey coming.
Oh, okay. Yo. Na okay, yeah, that's it. What diabetes, Anna?
Many pressure, many diabetes.
Okay, yo. Also age 52. Yo. Patrick, be you are no why, me that say. Me ma kwa body about that home so.
Oh, my God.
Yo, Patrick didn't be afraid you why. Me that say it you.
Again, doctor not a party push you in the other brother. Also, I don't know to my daughter to say, what you say,
Yo.
That is there. The thing is that we very taboo somewhere. Like, if you have no way, means that chemicals been at the one moment. I will use my and soon to me, because we are really at the time for my and I say,
because what they eat a lot of vegetables and I say fruits now, this are going to me because I will be in and again, I want my food. I pan the pan and you don't know if I get like if I didn't call on just no. And also, I then you need to cause it out. Or you have to be at 3 days. I be charging you and you can check what's in your complete time to continue.
Yo, me that say. Me ma kwa about the board down home so.
Also,
Me that say. Pacho didn't baby afefe.
if you from 50, I was so kind.
Yo, yet you.
Give me 179 over 130.
179 over 130.
How many times now check?
How many times do I check it?
We try check every 2 weeks.
And a consistent number?
And the same number.
To me, that from to me, cost room.
About from to
Eba for my acquire.
To me, that from there 150.
Over
150 over there.
Over 120.
Oh.
Okay. Yo. All right. What if you are? Oh.
Me there, Monday, me there, me sorry, and I'm just not be super.
Hey, this is serious. Now what if you are?
56.
56 years. Me pancho hospital. Doctor Asha Yo, yeah, that's it. Oh God, yeah, some more. Yeah, me ma kwa about the board down home so. Me ba short men kan. Men tishi say. Me ma kwa about the board down home so. Me pa chama radio volume nim na for my yen tishi. Yeah, me ma kwa about the board down home so. Me da say, pa show it you. Me pa show ka say it you. Yan tissue opening. Yo, crow it you.
If I show that is the young age that he had here. I'm dancing at the first one.
I and the hospital na beti me akwa check. Beti me akwa hospital. Won yare baba kan say pharmacy kra. Won beti me a check here ma. Why?
Okay.
Yo, me da say. Me ma akwa ba the board down home so. Hello. Aya Dum 106.3 FM Odo Ahomasuni Akumaa Mama Zimbi and Dr. Sakuku Dam Dr. Juliet up here ewaha and I've Dr. Mark ewaha and yeah she mema kwa body down so sorry when to me and you know so yeah sha see no yeah the hypertension education and a buy yeah to so me the BP diabetes hun common so near twetwe mema kwa body down so
Odaso.
Me da say, we didn't be free.
My children in Nikki, the first year doko.
Yo, yet you.
If I show more 21 years of age. Dr. Mark said, too much of sugar, no, it me how Obama.
Ebe how Obama will come benzo.
Sometimes, you know, me a virgin. Okay. Anna, virgin, sir. Virgin, so you know, not as you know, which is an expense to me. If we were banned, so I should like very like.
Okay, how old are you?
21.
21. Yo. Dr. Mark, be you are no way. Me sure so passing through this stage that. Me ma kwa ba the board down home so.
Madam, sir.
Me dance your him yet you.
If I have me sound if I can
Yo, yet you.
But only the
unless you are
if you are me ground and as a lady,
sugar is not good.
what's the name of this? Me too, I say, by me now.
If you feel to us say, Eba wana ho. Obana na esu no.
Aye.
Well, who enter your own?
Oh, there have an all 4 months.
Often all 4 months. And to stand feel free, I would you know hot chat to say 2 hours and not 1 hour.
This is her.
Okay, now if you feel few. Oh, okay. Dr. Julia, so go ahead. What do you want to ask?
No, I wanted to know, say, again, interest, and I was
Okay, entire day, I was share.
Oh, semi fat, I will send me France tomorrow. It's me for her.
Yo, yate. Me for my last caller, and that's about betting me in some nano. Me ma kwa about the border home so. So sorry. Me ma kwa about the border home so. Me ma kwa about the border home so. Me dance only my last call on this issue. Pacho would be free. All right, it's you.
Pacho, my 18 years now. I'm a step friend to me. My mind. I'm not doing my phone hospital, but still I enjoy.
Me Pacho sa kebi wa ya nte asiye.
Pacho, I'm a step friend. I will meet you. I feel driving here, my mind. My phone hospitals are in your
BP in him over.
Na mama na efi wo hrim anasa omunim.
it's still a name.
Ah, okay. Efi omunim na eba. Na ya na kala ne te say.
I just call on brown.
Oba wa na
Pacho, the Mawa.
18 years.
Pacho,
Wa ko hospital.
Pacho, my phone hospital.
Da be na ko e.
3 times in it. Still, I'm not doing to me.
O ya ma wa nro de.
But I'm not doing, but I know my anything.
Wa num ni nyina, unum ni nyina pepepe.
Yeah, all the pains, the bridges of.
Yo, Dr. Smith say ya na ohune so no, baby, eya wo ya na. Yo. Ye da se. Mon koso na muntie we bisa nsam ye papa. Ye call hypertension no mu bisa bebre. Ya be diabetes so eno so mu bisa bebre. Ye be ye woni nyina ano. Yeah, sure.
All right, and the first question no obi bisa so cinema me on na onya recurrent wound na e won nine back na but ma check it so what diabetes and oni
Also oni bi. Yeah.
or say only diabetes.
Yeah.
And there are other causes a bit me ama wenya recurrent wound and healing.
Oh, same place.
Yes.
Wow.
Yes. It been peripheral vascular disease. So or vessels no arteries na a what when I say a disease. You're not getting good circulation. Into no sano a crew to into me when I would tell you cruise so 1 and venous stasis. Veins no so wo honum no so say no so e we yare wo mu a wunya ekotu a wuntimi intimi healing
considering her age and so because I say 70
exactly.
Oh, okay.
Exactly. So chances are the immune system so you weak as
okay.
well. Yeah. Enti e was so de ne call na omo check here omo be ye BB e friend ABI omo be measure ne pressure no when the thighs and then inside. No matter say if the arteries there or the veins there are diseased, between the ultrasound so I share to make sure say we need any clot and I say any BB bisawa.
Great. And see on can Akumaa to the year.
Yes.
It's all not gone yet.
Yes.
Okay.
Yes. And we number 2 ni year me combining number 2 and number 7 together. Guy now will say or checking the blood pressure na 171 systolic, which is the top number no. And they also are checking the blood pressure 179/130 and multiple times so I check here when it's first one no I was see who say like last time no check here no so na higher because usually before I be diagnosed or hypertension you check your blood pressure twice to make sure say if it's still higher before I say yes that too. Chances are this high percentage say he does have hypertension.
Okay.
Because that's a very high
171.
171. That's stage 2 hypertension already. And see, if it's higher, we usually even start them right away on 2 medications.
Really?
Yes.
Hey.
Inti I was bomodiano now konomon check him. Inti if it's higher, if it's above 140/90, he needs to be started on medications and lifestyle modification.
Okay. Now one will say, baby, him said the checky and beep and if and your who number that was from him said one. What I say, and to a idea was from the was see and when you come boom, I can't show beer, but who say, mo beeping I was true and answer for Diana and yet a strong number
and yes, strong number but most people normal was systolic hypertension, which is a strong number. No, and we have diastolic hypertension. Say only a corner or so, yeah. 179/130, and sometimes it comes down to 150/120. Yes, both diastolic and systolic hypertension.
Okay.
And the estrogen, most people normal what essential high blood pressure, and yeah, estro number and a yet cassia.
Okay.
And people pay more attention to that as opposed to the lower number.
Okay.
And only a corner number 7, okay, so 179/130. He needs to be on medication. Like straight up 2 medications. I mean, actually, like US anchor we on bed admitting one diastolic blood pressure of 130. You're bed admitting
straight up.
To treat him for hypertensive urgency.
But I have been so there.
And I was so corner starting on medications right away. And I mean, the age meaning so kind of age or you're younger was see a shishim. Who said and yet secondary hypertension.
Now, so you're old to say 50 years.
You're old to say 50 years and up. Chances are it's probably essential hypertension, and they can start him on medications right away. Yeah.
And I usually so say, well, blood pressure I was so very much usually above 170. So yeah, now you start getting complications from high blood pressure, which will be leading towards stroke or eye problems, or even attacking your kidneys or even your heart. It's especially when you come and you're above 120 to 130, it's usually called hypertensive urgency. What's blood pressure above from usually within about 24 hours to prevent those complications, because blood pressure is one of the leading causes of kidney disease.
Oh, I see.
It's eventually if you develop chronic renal failure, and as in the kidneys best one of those things, and then it needs to solve. And you need to find a stroke, so a very big.
Okay. And so they will kind of so be and the BP I was through if I said 179/50. Okay. Now we'll see admit now. What do they do? Medication every moment I call low.
Yes. Into Ubani admit so you were with that, and then we have to give you IV medications because there was a lower blood pressure and within a certain amount of time. I say within 24 hours, and you medication through IV to bring it down. And then while we are bringing it down, we reintroduce oral medication. Drona now fan and I say I think your best start will be so you do better be so that it overlaps. And by the time our pressure and brought down, not the will take in by mouth also has kicked in, and then we send you out on that.
Yo, Adishima and Mama comment to yes, say ye no in robe bre ye no so bebre a boat nipediano. But they go on a nipedian air chin so na eba. And they want see a more comment to bebre. The hands of Bacako who doctor. No pay more a catcher no, said the would me catch or damasi. Now I can't say be a walk on it will be also on where Timmy at the amount. Yo, Dr. Juliet.
And number 3. Was the or Johnson be brave, but I quite check it so what diabetes or almost need diabetes. Yeah, so there are other causes and so I think that maybe started say Abia or Johnson training ya when you're pain because UTI, urinary tract infections, can also cause frequent urination.
Okay.
And thyroid disease, so when your thyroid is acting hyperactive and also can cause frequent urination as well. And I would know so we have something called psychogenic polydipsia. And also so no so be brain so I bet me I cause it that as well. And then diabetes insipidus so can also cause that. So there are many causes, and also they will do a simple urine test that can help like rule out most of the diseases. Yeah.
That means text in the cry, yeah, no, yeah, they should say, yeah, diabetes, when you're there, Eddie, would you swan a bisham?
For diabetes, there's a blood test. So there's a couple of blood tests that you can do. But right now in the US, we just use one called hemoglobin A1C. And hemoglobin A1C, and not tells us how your sugar has been within the past 3 months.
Ooh.
Exactly. So how controlled you are. And if it's above 6.5, you're considered diabetic. Between 6.1 and 6.5, you are considered pre-diabetic, meaning that you are getting there.
And you're not there yet.
You are not there yet. So those are the people now, Rebecca said, okay. Exercise, to medication. So now, but when you reach 6.5, then started with medication. So it will require minimum still because madam for be papa except say it takes longer. Let me say it takes about 2 weeks to get it, as opposed to the States that you draw it in the morning, by afternoon you have it.
Get it. That's the States, you know.
But me fasting blood glucose. Say o fast overnight. Now I check your glucose now. I'm gonna check your glucose level. And with fasting blood glucose, your glucose should be less than 100. Most people, when it's above 120, 126, is considered, like they repeat it twice. If you have that twice, you're considered diabetic.
Oh, okay. And say about medication, does it get to a point? A bit me I can say, yeah, Jainuma, say diagnosis of diabetes patients are. That king don't come but no sa.
Oh, me who be almost yetting you my free and so.
Okay.
Obi on a exercise. So what me exercise? Most of the people know mo ye I can see no. Say be on reduction surgery. No, I'm okay saying so. Diuretic, yeah. So and no son yet me you feel so. We'll be honest with exercise and eating healthy, we can take you off the medication because you can bring it down. So exercise is very important and diet is very important.
And diet is very, very important. Hey, how many questions is left to be answered?
Okay. So what's in the right hand? Not tingling and numbness. As a much training as I right? So and so with that, it could be stroke, pre-stroke. We call something TIA, transient ischemic attack. That a bar and that's like a warning sign that she should go and get checked. Measure the blood pressure to make sure and if you also saw nerves, a one instant is damaged that may be causing it as well. Okay. So with this, he definitely needs to go and see a physician. Yeah.
Okay. Although I think we level 2. How many?
Oh, we have a lot. But number 6 I'll see senesistos and a year unya headaches a lot now offer
F-pack,
yeah, which we'll see a pain medication. So when it comes to headaches, there are so many different types of headaches and different causes of headaches. We have migraine headaches, we have cluster headaches, and tension headaches.
Okay, so the migraine headaches, so your migraine, how?
Yeah, so migraine headaches, most of the time, bitemporal, when you chihanom, de emane ye or more light emane ye or more and sometimes you can have something called aura no yet say be on me ba unya some taste in your mouth and I say be flashing lights and I say something unusual be
comfortable
exactly almost seizures so ya no almost tenya or maybe you can feel the same or migraine so that's migraine but most of the headaches na ya tension headache which is stress induced. You go to work, be on my computer, and and we have something called medication induced, rebound medication induced headache. And this F-pack now, pain medication now, can itself cause the headache that she's getting because she's taking it more frequently. So with that, I also already draw medication no share how it will go.
Now, why you enough sleep and swear?
And also can cause it.
Okay.
And also can cause it.
And
And
even if
and even if you have migraines, sometimes lack of sleep can can initiate it for it to come on. Yes.
See, 8 hours of sleep and it's good for everybody.
Yes.
8 hours of sleep.
Yeah, though most of us don't get it, but
Charlie, how many hours do you sleep?
like 5, 6,
3, 4.
I'm better than you then.
But die 4 hours, and even that calls in between, you know. Oh baby,
You need
by His grace, we are surviving. May that say, Dr. Mark, yo, me just see it me you mon 70 na me boa.
Media back.
I can't get back. You go ahead, doctor.
I see there's too much sugar affect your manhood.
So say virgin.
They be sugar directly, into me affect Obama. This is other secondary causes. This is diabetes, and eventually, that could lead to impotence. But sugar, just too much sugar there. You see, we are young, until your body should be able to break it down fine. Until you shouldn't worry about any effect on your manhood yet.
But also, Johnson, so and I say, baby, dear chili. Also, as a spend meat lights near there. Did you ever feel such a thing, doctor, when you were 21?
It could be premature ejaculation.
And
I know it doesn't really have a treatment, but with your friend is in psycho, so more of counseling and psychiatric help, he can get.
So you have more counseling.
Yeah.
Did you when you experience what from that? Dr. Mark, yeah, man. Who film now? You who sir? Oh my God! A stage in a man's life. I said, man, the first time you see blood in between your thighs, I say, "Mommy, what is this?" At times you hide it, and you go and say, "What is it? What have I done?" You get scared. What? And one of me, yo, right now we are done, right?
Yes.
Is everybody happy?
Questions?
There are no more questions, baby. Every day, and I do. Ash. Hey. So Saturday you enjoy the one. No, I know you slept alone though, but
No, I didn't listen.
Yes,
We left.
So when you're but not listening to me.
No.
Oh my God, tonight you should listen to me.
Akumaa,
Yes.
We're all single, so
I
you
know.
shouldn't encourage us to. I
But
think
you
that
shouldn't.
should be for the married couples.
You need to no, but it's good for you to learn.
Yes.
You are clever.
Taking lessons.
Yeah, you're good lessons. These are good lessons. And speak. Dr. Juliet, you need to learn.
Yeah, I say yes, yeah, time, yes, yeah. I mean, but yours is very graphic.
Is there any sex position and is there any style? Wait a minute, the fire, wait your mouth BP.
Hey, and then they mean
And they wouldn't
them.
even it is love making is good.
It
But you
is.
should wait when you're mature.
Yes,
No,
when you're married. Yes.
When you're married.
they're supposed to help release some of the stress. So
Great. It releases stress. So you men, when you I know you're not virgins, are you? If you had listened to me earlier, you would have kept your virginity. But you didn't listen to your sister Akumaa, Mama Zimbi, over the years, so you broke your virginity.
no, Akumaa.
You're still a virgin?
Yes, I am.
Oh, God, praise the Lord. I pushed Dr. Juliet up here to say something she would not like to tell anyone. But look, he told me and the world that you're a virgin. Bless you, sweetheart. But Dr. Mark, I know you're not. Who broke your virginity? How come, doctor? How come you broke your virginity? Oh my goodness, I'm listening. Educate us. Oh yes. Hey, my shit doctor on the spot, man. I'm sure your people are clapping. Papa, hey, Papa. No, okay, do this. Be clapping. All of you, clap. Come on.
I'll save that for another time.
So I said, clap your hands. Bam, 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 bam. Papa, Papa. I want to hear you. Juliet, get up. Dr. Mark, get up. Yo, get up. Get up. Dr. Mark, sorry. Come on. Papa. You don't say, but clap your hands. Come on. Hey, Papa. Papa. Dr. Juliet, the virgin. Dr. Mark, broken. Now, dono a eye sonko ne ntimi emfa wo dono measure obi ade no bebia yentimi napo ama yetimi ada ema ye ato ye nim se nui kra no oba be fi atiasefo asase so nim se ba be hwere ye papa ye be hwere ye maame ye ba be hwere odofo bi so enso na wo mobro hu nti no yetimi hu wo mu nyina wo anim ti papa ye da se saa so na odo ahoma so ne besu ade bebre mede asedaka sie mo bi biara wuti odo ahoma so se owo Ghana ha se wo amanonne bebia wo bia wuti odo ahoma so ndofo Akumaa mama Zimbi impeni fo kukudam yina eda se enenso French ni beka se répéter encore na ene ebeba no na eye memri nda na etwe mu no yensaka eye Dr. Juliet Apia US wo and second doctor so Dr. Mark nyina abreche memu no mo no mati odom so for so many years enti omo de omo akosua no ompa holiday kakom se debi enra ne wa manonne no na odom so tenetene yen na eboa yen emeye fa sai kwa ketewa no so enti ene se abefie dia na nimdie kakra yen suasua no wo se ye de beboa na ekoma awafo omo so omo twempna edie nim a ebetimi atwen na ye ho ade ansa na edie ho no so no chese aboa brochefo papa se de eboa Ghana fo obi oti odom so bi eboa no enti ene wo kwensu no Dr. Juliet ewa ha na oni Dr. Mark wo mu nyina mo ha enne ye ba betwetwe nkomo a ebe ma nipadua no etimi enyi ache niam ebe we bon se bibi ejina ne enye enti ewo se ye na eye ntiatia ewo doctor any hospital no won ba be peja nyema sa nyema no amaye na ba ko any Dr. Juliet ma akaba
yeah
net say
nyamia dom na unso e
radina dom na ene uchi ne mwate pa
me sia me practice
okay Dr. Mark say yeah me ahun
Bako we are fine
Bako and Dr. Mark almost you romantic dodo because I not true bodo
sir
enti eya manemra kakra
your matter
like e fun nice okay enti what Dr. Mark any Dr. Juliet Apia so any na minim se wani age de be hia ne se obefa o pen any notebook and our pencil with me a jot ne madam kakra enne ye ba twetwe komo na ye bisa ensam no a ye bie phone lines ne ama obi biara na afei mo so matumi a kire mo adwene enne Dr. Apia and Dr. Mark say who be here say be twetwe komo afa hypertension de mojambro so no meboa high blood pressure no I can BP no any baba twetwe komo na no achi no so yes I twetwe komo afa dem
diabetes mellitus.
Diabetes. Yeah. Oh, slugging. No, if discuss it, diabetes. No. Don't again.
Diabetes mellitus.
Diabetes mellitus.
Yeah.
Hey, me na mesia dio. Easy. Okay. Enti de di kano ye be sha se ye BP high blood pressure no so. Any high blood pressure.
And you can say bibi moja broswa and I say high blood pressure, which medically in your friend of hypertension a measure wo wakoma e pompe any say wakoma e relax say moja no e ko wakoma mu enti high blood pressure no ye wo when ye measure will be pressure numbers me onu ne yehwe yehwe stro die ene asie die enti stro die no e measure when the heart is pumping and no normal ne ye 120 or below and asie die ne ye when the heart is relaxing force na e de blood no e ba begu wakoma no no and only asie die no and that one shouldn't be more than 80.
Okay, say my course, say me go check me BP. I will say a year 120/80, and I will say 80/120.
I will say 120/80 or less.
Or less. 120/80 a good.
Yes.
120/70 a good.
Yes.
120/60 a good.
Yes.
120/40 a good.
So when you go below, there's something called MAP, which is the gap between asia the and estro the and say a bro 60 difference and also say a problem.
Wow.
And also so no enya papa, but which we'll talk about that later.
Yeah.
But normally you want your blood pressure to be 120/80 or 120/70 is fine. 115/70, 101. Like my blood pressure has always been on the lower side, 99/60 most of the time. So that is also okay.
Oh, 19/60 is okay.
Yes.
Okay, so if you have 90/70,
that is a bit too low.
That is
unless you're on medications.
Okay.
Right?
Okay. All right. Auntie, mami call Dr. Mark. Na me Mrs. Se obi ewo e dey na cause high blood pressure.
Nyama bebre, I may cause high blood pressure. There are two basic types. But we find essential hypertension, or there are two types of hypertension. Essential, no, you need you need to pinpoint it because hypertension. I know usually about 90 to 95% of people with hypertension are essential hypertension.
Okay.
The other kind is secondary hypertension.
Okay. And secondary hypertension, there, let me explain it.
I know it due to maybe there are so many factors. Organs maybe or body kidneys one of the big ones, and other things like salt intake,
wow,
and body weight, so many other things, disease states, hormones,
okay,
thyroid hormones, and they are affected with thyroid gland.
Oh, I see. Enti so 1% will be through and now nyamojam so na e was say wo hwe weight.
Yes.
What say? Stress and it stress no ye your friend is saying sir obi ha no wadwen de biana Akumaa was so near Jichu Kasa, Nina, Mamma Musre Eba, and Dr. Juliet, Mammy Miss House say, and Merben, and I will say it's me who, yeah, temperature, no.
Yeah, blood pressure.
Yeah.
I was say, so we were able to say diabetes. I was say every 3 months beyond, we check it.
Okay.
But say in the normal population, say your population, way, let's say, only other diseases there once a year, so call for physical. They should do that. They should check your blood pressure
for you.
Yes.
Okay. But you will few bit more cast out of machine. You know it. It will more every week. Be able every day. Crowd check it. Dr. Mark.
Oh. Especially for high blood pressure. No. Almost some other diseases. Here said we have very close monitoring. No. Here and a sample also because high blood pressure there were complications.
Oh, okay. And to ever here say maybe I call doctor near checking who say a year na say and if you been at what age and I will be to me high blood pressure.
And high blood pressure a bit me happen at any age, especially age 20 and up. But usually say it happen and you can say it happen at that young age. So it happen at that young age. Not market say blood pressure you will move essential or primary hypertension and then the secondary hypertension. So say Akumaa and I say young person high blood pressure usually we want to check to make sure say any secondary hypertension because usually yana is due to something else. As opposed to say with the 50 and up, they that population group no tend to have the essential hypertension or primary hypertension. It is a Akumaa high blood pressure a very like important say be hwehwe mu ehu say
at the correct cost
exactly
okay
you know but say we obese ye ka so be obesity like you know exactly so obi a wo so medically ni ye de wo tenten and okese ye free BMI and body mass index meaning say they kind of cheap but
say ye hwe say wo tenten wo kese na eye pa ohana na otumu say the hwe say why ko ye tietia na kese why krukru abi na say hwe say the tenten na we kese say fatal who so kese dey fatal and so I say why ko soro kobo na wo soro aye kese na wa see aye ketwa enye ana wo hips tu wo ho na na ye na akɔhwe a na wo bi a hips wo ho ana ntu agina ho body agina so otimu say efinisru mesi ne form no ogina ho bi me da form wo Dr. Juliet Waters
enti say we obi a wo so bebre a na say wusa na wonya high blood pressure it could be say kese na wo ye na ne de we no ema wo pressure no cholesterol ena ebi one of so a nipa kese so omo wo bibia e friend obstructive sleep apnea so omo nya apneic episode enti
and the apneic episode is what
say hey let me try this is a meti aka we chia only akono da ohwan krom usually no omo ne omo da no mbeka se ohwan krom anadwo pa na ohwan krom dodo na ebi ono ma anadwo no ase we see like you know untimi home yeah untimi home yeah untimi home and no so can cause exactly untimi stop it home at some point but ohwan kromo pa nti no and also can cause hypertension as well and usually obese people perform so and they are motenya sa ade no perform so na ya no motenya sa ade no nti say akra a very imperative sa akra enya hypertension ye behwehwem ne ehu ne cause hypertension because most likely no yana is due to something else as opposed to say obenya no late stage
wow and oda humaso on the certified #1 radio station Adum 106.3 FM Obaba Akumaa Mama Zimbi and ankonyese kwesi esisi ne yire adwoa ena anko yese wadada me adimisa mama nyim ose anya me adabi na enno Dr. Sakuku Damieno Dr. Juliet Dr. Mark omo de omo adwea bom enene wodo ahomaso no omo cheche niema ebebo ni pedua no na yetena se ache yetime di odo ache Dr. Juliet meboa
no.
That's right and until and then no share high blood pressure
hypertension
and I say hypertension and no any okay me gidi say emeso ni be phone lines no a obenya but maybe say bisa questions ebeboa mo na mo call doctor na eno so metimi apay mo na mo aka ne ye papa BP oh height me can say oh low BP and also e den e mane cause Dr. Mark? Yeah.
Number one, in draw bit me a cause it. I'm almost high blood pressure draw. Almost very draw about one low on blood pressure. No. So offer me too much. A bit me up a form. So we dehydrated so a bit with blood pressure bit me I drop it. And even just old age. Regular old age and other yama is or body between my blood pressure back from
also then
so obi bleeding so
bleeding so I can't
yeah and me fan say my ye menses omo mutimi nya heavy bleed no e my pressure ni below
and sa kind of bleeding so obi nya ulcer na se ulcer no emutia ekro muti na se wo bleed profusely I say emoja ne ba bebra e betimi a drop pressure because blood pressure they say you can say measure the forces now wo heart in the pump you know e pump o blood and then over time no e betimi ama o pressure na drop it.
Okay. Metato awusa kokopa. Very nice. Na media me toa. Omo spoon bi omo de sugar no. It is a tablespoon no. Me ma oche mu 4. Ti me to kuku 50 pesos a. tablespoon sugar na osano me masa tablespoon o chemu 4 no de gum but ebi no so no yetimi sasa tablespoon no 4 ebi ya 6 eno ye sugar me ya can eno sugar intake higher e ma wonya BP ana hypertension ana and I say when you need be a dear my son your money back. I'm only asking. My a bit curious.
No, say you better sugar area no into you can you better discuss it. But sugar itself it doesn't cause high blood pressure.
Okay. Yeah. Okay.
And but it can cause other diseases, which we'll talk about one of them.
Okay, great. There was symptoms be to me with you know I say they may hypertension sometimes happening within me. Some be high bet me
yeah, hypertension usually in normal friend the silent killer because a bit me without you having any symptoms. Who nya symptoms be
and they're dangerous.
They're very dangerous and we have to be very careful when it comes to that. And some of the symptoms now ubenyano said me first blood pressure no cost so when you get over like 200 systolic top number no any asia then when it's over 100 that's when you start experiencing say obi on mo si ni ti ya ni ti pa no obi so na ni hwimu to moja say epistaxis almost ni hwimu like you know ni hwimu so ni moja you know things like that. But usually no, by the time you get to that point and now pressure you're very high, sometimes you can have chest pain. You're afraid be hypertensive emergency. That's when your blood pressure shoots way up, and when you shoot way up and you have end organ damage, say some of your organs, say your kidney, your heart start like you know accumulating some damages. That's when you start having your chest pains. So be on man and as bit me when knee like you know when you bit me you bleed and you can even have stroke. You can even have stroke. So by the time you get to that point and now pressure no like it is way up. And then very important say once a year at least. If you haven't been diagnosed once a year or so now check it.
Great. What can I say now? I'm man on when you mom so nice at that time there.
Oh, I need a different mechanism.
Okay. Oh, no, what you say? And what you mean? I said that not the emotional. And you say, and I say at that time they're different
different mechanism, but also we have something called gestational hypertension too. So be on my so timinya hypertension based on that and also can cause it as well. But most of the time no, you know your different mechanism yeah.
I see. And to Dr. Mark, should we have any lifestyle? And then maybe a bear, any hypertension, say BP, a bit me lifestyle beer. Obuhana onye bigger than if be a normal side so the Lord calls him or her.
I usually say Obiba clinic and I say the diagnosing new as a hypertensive, right? Not just or blood pressure usually the hypertension is some more different stages. Before you be diagnosed now you can say normal below 120/80.
Yeah.
But over 140/90 you started what we call lifestyle modifications or lifestyle measures. And now over 160 so 160/100 almost started drink say okay I was here do to a draw so.
Ooh.
Yes. Inti usually sir nyama over ya a do pressure never form no. One of the big ones exercise. And we do any with low sodium diet.
Low sodium diet. Okay.
Emma, you blood pressure cholesterol. Who exercise here or exercise or blood pressure not perform.
Say waiting for friend in your
about 30 minutes. I'm recommend about 30 minutes of vigorous exercise. Not just say exercise. I will think and say, oh you PP. Yes, I want them take care. One number. Akumaa crying bo.
It is more be an opportunity more on India or Nancy not to say any, no Nancy or to say any. Okay, good. But I was also me Nancy for how many hours? 2 hours, 3 hours?
Just about 30 minutes very briskly.
Okay, yes. 30 minutes will do.
About 30 minutes a day.
Morning, evening?
It doesn't matter.
No, it doesn't matter.
Okay.
It doesn't matter. So.
Oh, all right. So, Dr. Koso.
And I'm overweight, you know. So I want to lose about 10 kilos. Every 10 kilos I'll be losing, you know, or blood pressure, top number, no, systolic, no. It beats me about 5 to 20 points. So I know so very important. And we do the other things that you do, like fatty foods, you wash
okay, reduce so many na. You can fat foods ni man na study ni ane no. And I can study them.
This is
Na sanka abroje for mo study nam pa o. Ana. Chofi no ha. Oh, I see. Oh, okay. Adeshimaima Emma Akuma into Dr. Juliet Apia is here. And Dr. Mark and so Ewaha. Edu Emra maybe a phone lines nama mon, maybe Sebisana and Sem. Nemo almost some yadewa ho. Move direct someone call clinic, right?
Yes.
Okay.
And I have to say this, we're not here to diagnose. We're just here to offer advice and educate.
And educate.
You won't hear advice a bit media more, but so what you are right, you best throw say about doctor. No more test, no more diagnosis.
Okay. Ti omo educate ye ne ye ho ma ye ho so tie wo ye amenkofa ama APC ne nnum enkofa adwoa code ne nnum enkofa kwame and the cough me said be no esro bia ni moja ne niema enam widie mo entity said ye obebisa niema education niema information no na wetimi akọ doctor ho one me adwen ba akọ dia 0302. It is good me sure so ni age e papa mami emisa se high BP no high blood pressure and hypertension no ye inherited from our parents, Anna, do we?
If you all know my me, say you can't we secondary hypertension, no. You can say not mark can say if you all know my endocrinopathies, no, me I inherited and no if we parents want them. But essential hypertension you name the debate. Anybody can have it, you know, but we have modifiable risk and the ones that are not modifiable. Say we age, won't mean change you age, you know, and as you age, it comes with it.
Okay.
You know.
My family first caller. Me ma ko about the so. Yo, there was what to say. Yo, yet you. That's the one can't tell me answer. Mama won't cry. Wait, the American said, minimum as my Baba can say.
Maybe I want to make now what I say about my phone. If you make a deal, now I'm a charging class daughter of what I'm talking about. I didn't not understand. Now, I want to own crowd in the same car. And no more what I'm saying to you. If you ever saw that much support you're doing, I'm going to
Yo, ni soul no rest in perfect peace. In himself, or rade and chain. Ye mabusi nyina yako. Yo, me that say. Me ma kwa ba de board da homa so.
Oh, that's so.
Me that say. Oh, hima we didn't baby free.
That has me practical one.
Yo, yet you.
Mommy, please, I want to ask. I was diagnosed BP when I was 4 or 5 months pregnant. But from then till now, I still have it. And my baby is now 4 months. But I learned with the pregnancy BP, when you give birth, at least by the first 3 months, it has to go down.
Oh, okay. But sweetheart, ubeti mi ake omo ti tree pa o. Enti obi afra onti mi enka the tree so ho. Na ye nyanye se obi feel say ofra je oka brofo. Juliet ne Mark omo ti tree pa. Okay, Juliet.
Yeah, with gestational hypertension na ne kano. About 30 to 40% no, it doesn't go away. Okay. They may remain having the hypertension and majority of them go away, but about 30% of it still remains. You're still early part in your since postpartum, so it's only 4 months, so just give yourself some time. But you may be one of the few unlucky ones that continue to have it, because once you have it, your risk for having hypertension is very high.
Okay. The ability say to say enough calls. So make your notes. Okay. Yes, we can get a lot of people. Me ma kwa ba de board ahoma so. Me da say. But you did maybe free.
Easy from TikTok.
Okay.
I have a problem, but it might be a bit different from this one, but it's still medical problem, right? The mama who is shrinking, what could be the problem?
You are 28.
Yeah.
And what is happening to your
mama is shrinking.
Shrinking.
Now, can we achieve more? More yourself, be after a bro for Miss Penisa. Wow, Adishimama Miss Ramo, Monkachi, and yes, so a better drive away from not calling Monkachi, Namokatria, Juliet, and Mark, or what I say, you, Papa. Memma, quite by the border, Homaso.
What more does
Medas, so didn't be free.
But your friend took me up with if you are going to.
You, yeah, that's it.
Me pacho, me to the America can say, and the doctor's not to pass in Texas, soon called Yamay. And you so far. It says, I have which is another hypertension. I'm also if you Indian dinner, quiet, if me and I deny and also come. This is also come, but the inside says, Lemma, you probably has a be inside. Okay, 13 minutes no come. They're correct for Andy, and don't want to. And I'm patching the same thing on there. I come to one hour to shoot. Once over our cook shoot to cry into me yesterday. And also, I then of course, it's how we
as a hard bands. Okay, yo, yeah, that's
okay. I will feel going.
Yo, yeah, that's it. And in so many nights here, Mamma, about the border, home so.
Odon so mpacho me kasa free hacho pemeja ben
yo Mr. Ja
se ufa hypertensive drug na diuretic ka ho a ubet time be ba ubet ma afa the diuretic en ka ho ana na say so continue for the diuretic en ka ho forever pacho ba no si
yo yeah that's it on be yi mu ano ye fa course ne kakra pacho bibia ma na radio volume no emra form me ma akwa aba de bodo ahoma so.
Oh, don't so.
Me da say, we didn't be free.
I try to come in free draw.
Yo, yeah, that's it, you.
If I show a one, a cocoa, it's me, I was just hard, and I'm a chin, so it's me also.
I started how many months in it?
3 months.
And I bought Pelpe one, and I say I was so keke.
It's me also, my defense. It's me, I was it's me also bear women.
Okay. Now, won't call hospital cry, Uncle home doctor.
I'm call hospital, but mommy addressed her.
I go so say follow up. I don't know about me, only my drone. Oh, okay, yo, yate. Yeah, that's it. Me ma kwa ba de ba odo ahoma so.
Oh, don't so.
Me that's it. Na me mai we he. Me ma kwa bo odin ni baby afrefre.
From do me first morning.
La boni yo yetio.
Mama say na doctors no wo mo ba mo ma area wo mo ye ejuma no because e bia wo be ko hospital e bia na doctor bi na wo e bia no a dentist e bia wo ka so na doctor kwa mo ko e we fi mi ti mo area na ma fu mo say ye tia de no mo say doctor ejuma differences wo.
Yo me pa cho omo nye doctor se wa ha omo ye doctor so America what you say omo go so Asia but no ba holiday no mo ti odo ahoma so pa enti nim de no mo educate mo se mo betimi akọ hospital no causes and symptoms what you say ti
ma me sa ni aso fi mi no nya me be person be say na na say intata no ya na difference wo me nti nya na obe mo say hypertension de
yo what me da say Adishimaima Mobaba Akumaa Mama Zimbi ni odo ahomasuni eneno akoye ye hwe ye wedie mu eni emu eyarewa eno honimdie ene ye de ma ye enti wonso obetimi afre 0302 216 561 0302 216 562. O friend mama radio volume na abafom na fe won so wetumi a kire wadwene medas me ma ko abade ba odo ahomaso me ba chote menka
Achai.
yo hima ya fro sign baby afrefe me ba cho yentio so sorry went to me enyina makanipa miensa na fe doctor eyi insem na no me ma ko aba de bodo ahomaso me da se pa cho ma woni so na me ntche kra why
Good evening.
me da se wo yiri ta ehwan kromo wan kasa so oyem show na wakoma ebo enye sa
na kanche ta fancy shimon akon me push shimon chambom kin me ja shanta na kai hapita
yo na UK ho no unko hospital unko hu doctor bia e on
na hanon de na doctor I want to make us a good and I something because sometimes the machine there that information because before not
she will say me pacho yo. Me pacho yo. We are so grateful sir even from UK Crown so waje your doctor say na uti education wamo Emma. My main family last two callers then she can start answering the questions. Me ma kwa about the board maso.
Modern so
Me da say we did baby afrefe.
But your family kwani me fe fit akwali.
Yo kwani etio.
Pacho mo problem kakana be se music. Pacho tamana ye secondary school na madam for the training and Drovia. If let's say I'm having some effect on it, I want to call it after as well. I can make me a solution here.
Okay, Kase, no be one more reading.
Like those kind of China medicine, no. But right now, when I'm having sex, I find it difficult to make what in the sorry.
What kind for these years, Nana?
Yeah.
What they now the slang one I said they won't no one they will spray maybe.
Not the no maybe.
Hey, now who goes to Kun so now can no way I day. When I make you? And one who send around for how many years and how old are you now?
Right, I'm 27.
And one who been known for how long?
Oh, on it, like yesterday, sometimes.
I see. And say, who's just say, what is happening to you when you are making love?
Like right now, when I'm with my fiancé, I find it very difficult for the penis to.
Sorry. To erect. Sorry. Sorry, Bill. I am a mobile cranny. Men casa mesero, but oh, these are some of the things. Anyway, the doctors are here, and then by His grace, you get a solution. Any education. Why? What's say school? No, I'm sorry for these years. See, not age national the age. At 27, they say, I find it very difficult. Second and best. Sorry, it isn't sorry. Jojo. Oh, 6:30. May family last caller on this issue. Me ma kwa ba de ba odo ahomaso.
Model so.
Yo him I would baby afrefe.
But mama so I'm Kasasi Madina.
Yo yetio.
About your city me kola brimla, me venu efimuja. Me venu efimuja, me kola brimla. Let's start. About your person visa doctor me say. It me blood pressure no ko low ana.
Still I will cream free moja.
But I was
Wedding fear he.
We were 21 years.
E dia na wo ye ene ma wo mu moja ne ba.
But I need me to meet you. Me kola bloom to na. You can say me na say ba nobody. We nobody buchia no or the woman na echa.
Yeah.
Anything na so eba.
Yo, okay. Me that's my papa. Dr. Juliet up here and Dr. Mark Omoha. Says me hold on with call in. No, na ye in somewhere no. Every be more. You be sign afa course ni bio. Now more enjoy your damas when there. Okay, yet you.
Me started with my specialty. I'm board certified internal medicine physician. US. Na me ye juma University of Connecticut Health Center. So that's my specialty.
Okay. Dr. Mark?
And I'm a pharmacist, but I have a doctorate degree. I trained to be a doctor of pharmacy. And I'm a cardiovascular trained pharmacist, which means me in Juma. So school I'm a koyeno. It comes with training on disease states. Diseases and part of my work involves knowing disease states and applying that into medications.
Great. And both of them are credible to be on Odrahoma, so to educate and inform. We are grateful to have you the second time. Okay, Dr. Mark.
I'm a lecturer at Central
University.
And I used to work just 6 weeks ago. Now I'm a clinical pharmacist at Indiana Heart Hospital. It's one of the top 100 cardiovascular centers in the U.S.
Wow.
Yeah.
Congratulations.
Thank you.
No, what it says is additional say on Baba Akumaa Zimbi. Yankofo keke emets na so ye tobe. No, we don't do that. Yes, I can yankopo yin self your dahoma so. And it is good say yes I show mubio no mu say munyin back to on the machine. Radia don't cry. It's small in bones, big in brain.
Yes.
And then yes, sir.
Yes.
But I say, and then one yes, sign. But I say, yo, you know what I mean? We pan. Okay. And so you know, yeah, Baba Sheshe Monty, Dr. Juliet.
And see, with gestational hypertension, they can't want some. So when you're now blood pressure costs, so they be more high. So we are, we cramp now.
Me have been such a person on a book, you know. So answer will come from internet. But me yes say I want you to go slow. Okay. Yeah.
Okay. So gestational hypertension and I can say. If you all know my so when you now hypertension it never really goes away. But I know a very few percentage. Until with time it may go away. But the fact that when you be the risk of having hypertension in the near future is very high. But question I can be person besides almost the need 2 medications so
okay.
Yeah,
and to see say they want 2 medications so and I for one to swallow. Yeah, give us the both.
Yeah, and if you all know my blood pressure is so high, say they have to push you on medication.
Because of medicines like that.
Okay, so just go through again.
Okay, so basically, penis, a muja and a man, a cassia, and a ketwa.
And a veins in zone.
It's capillaries.
Okay.
So it's like, I said capillaries, the blood vessels in kitten.
Oh,
muja, a dim.
That's right.
Oh, muja, and you film. Then a money, a cassia.
That's right.
But so to get an erection, since a samba back into it, and then the more blood you get, the volume increases, and then you get that erect. So for him, there could be several things that can cause it, but one of them that I know, testosterone, steroids for during those steroids, that can potentially lead to that. It been so they tend to have those symptoms.
Really?
Get
one. Just a woman with the structure bole. Now I see all your oh, and then they say, in fact, oh, mama, yes, sir. There was that time now, muzzles in the battle. I see also about it. Oh my God. Okay, so that is for him. Yeah, okay. Juliet, continue, please.
And the next question was obia onya heartburn, which we called GERD, gastroesophageal reflux disease. Inti no enuani bi wo ho no ma ebetimi amana ba bibi te say chocolate, the spicy food. So we dey aduane ameko bebre wo mu a. And as sa ade no so wo so a eni kwan say wo da flat.
Yeah.
Yes.
It was
so
and so what I say like this.
Yes.
What do we achieve better home?
Any kwanza what
Now when you air
yeah, especially right after eating.
Okay.
What did we was our say for maybe about 30 minutes and sana obeda wada. And usually almost symptoms yana banajo because of the way now obeda yeah. But what was I there no so you are prone of getting like ulcers until was say you will know a bit to prevent you from getting like gastritis, say irritation of your esophagus ulcers that's something that only I couldn't be that question may emphasize so uncle who the doctor so don't bet me the not to proton pump inhibitors and I say like H2 blockers.
Great. Yeah. Okay, yeah, what a circle.
And you want to take number 4, diuretics?
Number 4, no, not obesity or fat diuretic, and blood pressure medicine, me free diuretic in this one. The answer is yes. Basically, I check blood pressure. I say, diuretic in the free. Free regimen, this one, or blood pressure will stay low because the diuretic is in there to also contribute to bring your blood pressure down. This only back home unless you have side effects from it. And I say, electrolytes, but for maybe a potassium, one of them. And and I say, you are getting dehydration from it. Usually they still keep you on it, but yes, the answer is yes. You can go off the diuretic, but when you go off, make sure you monitor your blood pressure to make sure you do not have that rebound in your hypertension over time, and then also make sure you notify your doctor say who free because
important,
very important.
One couldn't me for pet say it did me free so the food for yes and I will cool slowly. Okay.
And as we share recommendations in the crown see a diagnose you with high blood pressure. The first time they be diagnosed you diuretics now almost recommend the CM found to so unless we are diabetic then ACE inhibitors, which we'll talk about when we speak about diabetes. And I think some person who says what diuretics so the additional medications. So if the diuretics is not controlling your blood pressure, yes, add the additional medication.
Okay.
And there are different class of medications that you can add to it so that you can have a better control of your blood pressure.
Okay, great. Major sir in some movie and no one Dr. Juliet up here and Dr. Mark. Omogusu and Maui. Woman ye auto Ahoma Suni, Emano Yawan, and yet they be sorry sono, and I drew a bed de Emma Waffle. Then also a mark pressure not up or down, another boy. That's great, that's great. Okay, to
intimate combining number 5 and number 8. Not obesity palpitations na Akumaa bo and obesity ni yamtimi shele na Akumaa bo
and US or UK
yeah and symptoms ni mienu nya na sa ukabo ma chese palpitations Akumaa bo peri and causes no ye many and the okase ya na ni yam shele it could be anxiety or panic attacks so bi ono ma odru ni pemu a Nana Akumaa bono or sweat.
And I said, hey, name
exactly.
When did you go say, hey, what's him don't make machine you? And people like that.
Yes, a bit me anxiety. But the feared ones is arrhythmias. Say arrhythmias. Akumaa. Arrhythmias is cheer there.
And okay. Before Akumaa be born, I say Akumaa electrical activity be and FM.
I said was supposed to be nana.
Who said so? Means watch video of Obi Akumaa airport and we say a contract and I say me na for me be. I say a form a big kakra. But for that action to go on, for your heart to beat and contract and relax, there is electrical activity that is generated from the top of your heart called the sinoatrial node. So electrical activity, if I work on all the heart muscles, there are times when usually there's a coordinated effect. Let's just say, I say up a statifree now form. There are times when there is instead of just or statifree now or female will do form It may cover baby, it may have it may be brace. Usually you need 60 beats per minute and then normal. I was about 60 times about 1 minute. 60 to 100 you're normal.
Yeah.
But a year baby more than 100 Diana any what think
what the science oh.
But there are times also what near friend arrhythmias, you know, any dangerous ones, you know.
It no means say electrical activity now send the signal no for Akumaa to beat now. Is disorganized.
Oh,
yes.
Okay.
You know,
as I entangled,
yes,
so
exactly.
Wow.
It be on my very dangerous. A bit me a kunkra. It is a Akumaa a boss sign up problem. Anxiety. Anxiety no ye psychiatric more of way. Into there is not a bit of an issue, but say if you are say electrical activities no na disorganized there, you need to be seen. You need to be seen. And sometimes so obi ono mo with thyroid with thyroid ni chi woni thyroid chi
friend say throat where they
thyroid chi but I will honum say hormones na bi honum na bi baako say e cost through too much and also betimi Akumaa bo tem enti eno so ya de we say okonom check enti say ukọ hospital say USA uba ha no na wo palpitations those are some of the stuff that we check. You know, you better check it with thyroid function to make sure say it's not coming from the thyroid. Me had what to e be also had what to monitor so to make sure say yes arrhythmia na ye kan ho asem the disorganized electrical activity no and so enti we a very important say nkofo mienu na mo say Akumaa bono omobekwa hu doctor because
okay na obi so say ye bo ana eye ne ya eto le bi e ba sa no na munsu ye ne ya
so
the chest
what's in the chest so sometimes so heartburn and heartburn can cause some pains in your chest. So it could be that there's two things going on, you know, and yet palpitations, no, and it causes with pain. But Akumaa ne born 10 so you can leak enzymes, and also so it may cause some chest pain. So it's very important. So mobile call, normal checking.
Although I must near yet what was so it is about 3 ye de bebo ewie me boa. Okay. And Dr. Mark, which one are you going to do? Yeah, I hope say and church training na ya de ba no mo sit ni na asi papa and they want to see no hospital. You person who yet throw believe in yourself. Who yadi a wo yare kwa no pay much doctor no pain we hu much ro. Fedi bi anim man twen say radio so na obaba dey Dr. Saban san obeka ma wonan yentia e wo hospital. Okay.
Okay, next one. Yeah, so change on name. Your friend edema. There are a few things that can cause it. Number one, no.
So when you say na would not tataya.
So when you send us on answer tataya.
A bit me happy, Bema, a bit me happy oba.
Yes, Obama, Oba.
Okay. Yo.
Usually, how would you know chair? A bit me happen. So over certain types of Akumaa area. And it's a bit may happen. Even old age, and you overweight, for no, now they can get that. Certain types of liver disease can also cause that. And a kidney disease also. Until now, we be a bit more issue age now, and I say a being PD forward flow of blood can allow the blood to go back. And can cause edema in different parts of your body. Okay,
and see, so when I said tatai, Obo have me find so otna. And if I said VIP more from Akumaa, Obeko dan na say atatai. Within some few hours, no, I normal. But what dear no na intimate normal, it take about 3 days and 2 days. That was so doctor, right?
That's abnormal. Yes. So the only Akumaa watchna for long journey no is just venous stasis because what time for Akumaa change. Sorry, it was set circulation on return back. But the encodia it was so go doctor because then there's something wrong.
Oh, okay. Na especially if you have ultra flight move for a very long year, it may happen.
Oh, okay. Because more journey to it means circulating during that period.
All right.
Yeah.
Sometimes in the place, some people doing a little walk, you know.
Yes.
Mattresses are not on anti-mokakra.
Yeah.
So yeah, it's good exercise, right? But do you recommend that? Is it
Yes.
safe?
Actually,
Say even in the plane, ultimately, sorry,
Yeah.
no one anti, I can't be almost stretch it, you know.
So far as there is no turbulence,
yeah.
we are okay. Actually, it's recommended to do that, especially for very long trips, because there's something that we call DVT, and a deep vein thrombosis. Blood clot, between forming over name. Between travels to so we check our lungs to cause what we call pulmonary hypertension. And as a bit now, stroke.
Woo!
Yeah, so it's very important. Say what's nasty? Say what took us? What's nasty? Basically, what happens is mujani ijna fakwa, clotting.
Great.
So getting up to do those walks will help or just circulate the blood and prevent the blood from clotting. Usually, it's a sativa or calf. That is where usually if a DVT or deep vein thrombosis will form. That is why it's very, very well recommended even worldwide.
Okay, great. And yes, I told a bill cookmas never VIP. I do lend the door. Yet me see a bit more so a bit anything. But there are some other people on see on your shay. So they say yeah educating or down once say yeah call long general ravage and ube did you but so at least get down. Not take a crack. No more generating near for Sunday. Go play will come exercise. Not the be edgina. And wow. No on swa. Very long journey, no. Then meaning say a lot of drivers so much here. A very good say you call about 6 hours driving near Nantika. And how many hours do you recommend?
Usually, I almost say every 3 to 4 hours. And I was so sorry to run them. And Obia says that DVT now can when you be done. They actually recommend say Ube fast stockings. There's compression stockings, like like. Stockings be on my year
special
especially for like more snack more nice timidity and I say when you start DVT in be parent and no it help with the circulation meow and to help with the circulation. So I recommend say like every 4 to 6 hours be ubeti me asori na 90 car no kakra pona
na space ni car mo
say
ye
packing na
ade ebe hu pa o say ye kwani apake driver so pentama kwa ba ni sales ni ade ai na be ka che wo ka una say enemy gina be 4 hours na me passengers na
me a massage wo 9 so say ohun say what transia wa beti me a massage wo 9 kakra say de be ya you get good circulation.
Wow. Although Ahumasuni unya this kind of education anywhere. Joe Baba Akumaa Zimbi na Yankopon asoma ne bafo kronkrono amana adirect adofonum na omudi omunim die no abetai odo Ahumaswachi. Eya nanti a ye tu kwan ye adwuma minim so China wo do ho baby omo ye adwuma omo break time omo ye exercise kapa. Enti banks ladies omo ti en kg simu. Any other places, you sit at one place for so long a time. And so what do we do?
And Nina can't be into the break and lunch time. I say you maybe could be what time of my break. So your break time is not just for a DD, but I was so sorry now 1990 kakra. 90 you're very good because it gets your circulation back, and see. That's what we recommend.
Okay. Mijidi said we've answered all the questions, right?
I can't baba kwa me person me touch on onya girl no assistance so ya kra.
Bleed.
Ni mutu moja no. Nti e bia no wo bleeding disorder or yarea ema emoja tuno and nanka me pese me bisa ne say ne hunimu pe ne tumoja na so onya ne menses so o bleedi bebre because there are certain bleeding disorders a betimi causes into with that na we so ono so koko hu ne doctor now mo investigation to make sure say like oni bleeding disorder because some of these bleeding disorders also can prone you to having these DVTs and PEs that we are talking about.
Okay, great. So say I hope you all agree with me. Say and jumping and got diabetes.
Yes.
Oh my goodness. It might be me.
Akumaa was so. Why a memory?
Emma Bemida, Emma Bemio, oh, Emma Bemida, can hear we hear no Emma Bemio, oh, Emma Bemida. We are in the enku and tete wo. If we say Odahuma so, Yakaya hypertension was say ye be call your diabetes so. Now wouldn't mean deal way who I better than a becum enku cry. Once again, with your big piano, you won't be our club, the bad certified #1 radio station at Dum 106.3 FM, and what Odo Ahuma so, Akumaa Mama Zimbi, and now we are blessed to have Dr. Juliet up here from US and then Dr. Mark also from US. Me mama kwa baby to the second part. Hello. Message me back too much.
Okay.
Yeah, people are enjoying you.
Yes.
Okay. Dr. Mark, what is diabetes?
Diabetes in a short form. It's there are basic two major types. There are several types of diabetes, but I can't want to say type 1 and type 2. There's also gestational diabetes. Are pregnant, it may experience it. And then there are a few other ones. But type 1, producing insulin. There's no insulin production. And
they can't insulin na near shedding.
Hormone which is produced in the pancreas by the beta cells in the pancreas. It may break it down glucose and that's it. Sugar. We do
so the make up cocoa tablespoon 60. Now I talk about 50 pesos. Now we drink on my sugar didn't come. My sugar didn't come.
So basically, there's no production of insulin.
Okay.
And type 2, they produce some. There are usually 3 different mechanisms. Number 1, insulin pancreatic cells produce insulin but and dorsum and so. And there's also type B, or body cells are resistant to insulin in our body.
Body produce okay.
Resistant to it. And a third one, so resistant and then no production, and a third one glucagon production at dorsum, which is so when you sugar and dorsum, our body will live and convert it. So sometimes say how do I explain that?
Yeah.
I'm trying to find a better way.
Yeah. A better way, help him explain. Not yet, listeners, and TSC. A poor house said, Dr. Macanca could do pepper, so what TSC. A poor said, be a do a confusion a cry. It's in a was say, say a diabetes cry a day. I don't know, you see, me.
And see, when what can I say, you will move me, you will, dear Omo produce, so they are just deficient in producing, and that's the type 1 mainly. But type 2 now, majority of the people don't have it, and that's usually the adult onset in Timpenifo diabetes, most of the time, and mainly about 70% of it is resistance. That they are making the insulin, but their cells now are binded to the insulin. Is resistant. The receptors are resistant to the insulin, and see that's the main one that we treat.
Okay. You now didn't cry a cause diabetes now. I didn't maneba.
Okay. All right. So diabetes. When we talk about type 1 diabetes, it's usually autoimmune disease. Autoimmune means our body produce immune cells are attacking your own cells. And see, there are a couple of diseases that are caused by autoimmune disease, and type 1 diabetes is one of them. And see, the main reason why they are not making any of the insulin not at all. It's the almost self no produce like cells are ekele. Yeah, ekele beta cells na produce insulin.
Oh, okay.
Oh, and see, you're fighting against your own.
Great. My breaking it down to say some people will get. But him said the Kenya don't want to see. But who also I am more confused.
Yes.
And if I say one more me, no, away your name. Oh, and a back on a papa, and a back on Sonia papa. Great. And the Enya papa no, papa no. Right?
So, okay, Mammy just admit you're breaking it.
Yeah, break it down.
Mammy just admit
so guy hammer. You know hammer?
Yes.
The physician. I'm going to break it.
So, now our cassette will pancreas and it produces our insulin now. You need it to mobilize sugars into the cells. Right? Into our pancreas, and within that pancreas, we have islets of Langerhans cells, and no, it produces insulin. And see, body no, semi-fast your injection. Say, Ukoniaka say immunizewa, omu build the antibodies. Say, sa infection now my immunize against no. Sa infection ba, sa antibodies no. And a back kill infection because you have already been immunized. So the same kind of process. So your body has produced antibodies. It kill cells now. It produces insulin. So that's type 1.
Okay.
And while body fights it against the good stuff that you need.
Okay.
Exactly. So that's type 1. And type 2 no is you can inherit it actually.
Oh. I see.
Yeah, that it's one runs in families.
Families.
Yes.
Okay, it's minya fee emoja ya papa ho, ya mama nchen, ya nana kan so bi ho.
Exactly.
Ade fat kwan ben so.
That is unknown. You know, be unknown man, yes, some kind of genetic mutation be and say the way now your body, the cells that your body is made of, you know, it be no when your mutation be and a man causes that.
Okay.
And it be so obesity and cancer. Fat cells. Yeah, exactly. The more fat cells you have, the more resistant your insulin receptors become.
Okay.
And also can cause that.
All right.
Yeah.
You put it. You want to simply put simple pa no bi antia say. Said you who say ne maybe what diabetes. Dey na me hu. Na metimi aye me na intite wo hospital.
Okay. So some of the signs and symptoms. So person who aneme yi na di say wunya diabetes is polyuria, which is you pee a lot. Ojunso bebre. Throughout the day and at night we call something nocturnal urea and night.
In what interval?
Oh, it can be as frequent as every 30 minutes. And then at the same time too, you get thirsty a lot. So polydipsia, you'll be drinking a lot of water because you're peeing and you're drinking, you're peeing and you're drinking.
Okay, now someone said diabetes, symptoms exactly. I could do more. When you say traffic, beba, FIFA, quine, so there's traffic, I could do so. Can't in tree, when I use a sand. Yeah, when I say driving, yeah, sure about you, sir, go home in some. Okay,
yeah. There are other causes of polyuria, but that's one of the causes.
Okay,
I bet me I'm more Johnson tentem, and I feel so no so tentem, and I feel so come deal on tentem because insulin stimulates hunger. Start insulin na ye can want them. It stimulates hunger. So type 2 for no. More insulin no circulating around, but more receptor in your trumano. The more insulin you have, no, it stimulates you to be hungry. Until we will send up polyphagia. Would the be brave? Would the be no so be brave? Not just so do be brave. And I feel so you become fatigued. You get tired easily. When you're
okay.
And at later stage, semi-fan said, glucose in your brain, so you can get confusion. And some people can even go into coma.
Wow.
Yes.
Oh God.
Yeah.
The diabetes and yet.
Diabetes made there be a say is one of the most scariest disease ever because a scary mostly HIV. It can kill you, like but before na be kuno. A best sell when you be brave. Exactly. So we'll talk about some of the complications I think later on, but diabetes I did any consider because they're very dangerous. Yeah,
I say. Ain't see one more. Be my friend, so move be say I want day back I can ah, my job drugs not to baby. What are the cautions? After you been also somewhere.
Oh, once you have it, you have to take your medications. I was our medications, and I will use this opportunity to make complications now.
Sure, do, yeah.
Because this disease, no, the way that is here, no. So one yeah, before I'm saying no, not just what bread, a bema what bread. When you bet me a fra, you bet me lose your kidneys and go on dialysis. When nerves wouldn't mean feely share. Like I said. How do you say
in my language, that's an answer. Actually, now we are
yeah, now won't feel it. So, and
body now,
yes, body now.
So, being a stroke,
exactly. One tissue, and Usha and confirm what diabetes is. One of the symptoms, and also I will be to me and a crow too, next in Helia. It could be that you have diabetes because there's impaired healing with all that glucose circulating around. It impairs your immune system.
Bibi kitso bi na 18 no oye de na anwe bi ana bibi second bi na twa no kitikiti yo enwuda enso no de di agbasa ya kitikiti yes obo hu na ebai na ebai na odisie ne de ntoma kata niama so wow
enwuda ena obi onom so a ekuro no pokra no ne nan etia that was so crampo now on taste and na yet be so na etu kro because the nerves ni nya adwuma is so saturated in sugar that enya adwuma.
I see.
And see, yeah, that's another sign.
And see what dey esisi bebra emma o nerves ni wu
say when the sugar in your body outweighs your insulin now. Yeah, your insulin production now. Yes.
And see, I did what that agina better won't
because you nerves now. The amount me
feelings now. And see what
and another one is exactly.
Also, you know I want to maybe I think yes,
exactly.
Just a bit of feelings.
Exactly.
Oh, this is serious.
It can cause penile, problems too. Yes.
Wow. Yeah. Jesus. Diabetes so who some any account or door almost see. Now I just said, don't want enya sex problems. Me feeling no. And you me the say partially no. A bit more diabetes.
Diabetes can cause that.
Okay. It's in Pamucho and Akumaa and Yamid Danoted.
Yes.
Wow. Okay. Dr. Mark, then other persons now me realize and only some more questions. He educated woman.
I'm saying what can one of the things diabetes makes me contributed to heart disease as so.
Heart disease? To never been a bit me I avoid it, then I open the lines. Never been a bit me I avoid it. And now because it's me inheriting into there's nothing you can do.
Oh well, exercise is very important when it comes to diabetes because we bet me reduce your weight and most of the type 2 no. Yeah, normally obese. I come home to bet me reduce your weight and no can help. And your food intake so sugar intake no. Once you've been diagnosed with diabetes no, you have to stop sugary food and drinks and stuff like that. Yeah.
Okay. Now say you fire phone na you yeah. Yes, say I was so banya nufuso. Till the Janet Tata was out to fuck him on yeshi. Nancy when you bones out to an bomb.
This is a jai sow.
Yeah, sure, it's happening. Hey, Obi a penny na people bossy a few for years, man, yeshi, and sit and say, oh man, your baby be a mama, ye normal woody. Ye normal would do what I say. So book it.
And Luna, I won't say you're educated public about it because exercise is very important.
Okay.
Exercise. And there be I make us say Africa no nyame na hwe so because ye nanti bebre, nye obia na worker, you know, most of us work a lot. Now, because when you come to Africa, in the States, no, and you have diabetes. But when you come to Africa, I feel like says for mum and diabetes because I think are the ones.
Which I say, what
yes,
and you for diabetes.
I'm no diabetes. It's social economic way disease. I have for because I'm not with junk food in this animal, right? I have no to say the Sika junk food, right? It's going so fried rice in this animal. It's here for diabetes in China. Here for
I see.
Exactly. Okay. We have to watch what we eat and we have to exercise a lot as well.
Okay. Mommy, me line